Hi everybody, Dr. Shadi Ireifej here, board certified surgeon at TrueCare for Pets. Also chief of specialty at the facility there. We're a 24-hour hospital, 7 days a week. Come by for any emergencies you need regarding your animals. We'll be happy to take care of you. We're multi-specialty. And I'm also part owner. So if anything you need, just let me know, reach out to me. I want to talk today about a topic that has been sort of on my mind for several years. And it may seem insignificant to those that don't have any pets, but to those who've had pets, especially pets who've had surgery, it's in reference to those e-collars. Those Elizabethan collars that the doctor will make your pet use so you don't lick any of the incisions or any growths or wounds on your pet. And no one likes these things. If you haven't seen them before, the e-collar is one of those kind of transparent lampshade things you put around your pet's neck. And no one likes them. You know, they knock down furniture, they scrape your leg, they cause all kinds of issues. And the pets hate them. You hate them. You're worried that your pet can't eat and drink with them on, and it's ruining their sleep. And so I want to kind of talk to you about the importance of them. And because of this sort of all around hatred towards this apparatus, veterinarians sometimes will find reasons not to use them either. And as a surgeon, I've seen some pretty disastrous consequences to not using these cones. So I wanted to kind of go through why we use these different, more creative solutions there may be, and hopefully drill the point home as to why we should start using these for any procedure, no matter how major or minor they might be. So we use these e-collars because dogs are not people, right? They don't understand that the procedure they had done to them is for their own benefit, and that procedure requires some level of healing time, which at the earliest is probably going to be a couple of days, if not several weeks, and sometimes longer, depending on the procedure and complications and what have you. So because dogs and actually cats are going to manage their own wounds the way they would in nature, which is by licking the area, right? Cleaning the wounds, making sure that they're trying to protect them, keep them free of debris and infection. Well, they're going to cause trauma, and to what your veterinarian has really tried to work hard to prevent, things like infection and surgical failures. So we use them because dogs and cats are not people. They don't understand they should leave this wound alone. There's implants, there's sutures there, there's some vital structures that are behind that incision, and pets don't understand to leave it alone. It's as simple as that. And so we don't really have other ways of portraying that information to them. You can't scold them, you can't teach them, you can't verbally tell them, hey, don't bother that incision for like 2 weeks, right? They're animals. So we need them for that reason. And it's got to the point where, of course, it's comical. You know, there have been plenty of comic strips written about this with the cones and making people wear cones out of jokes for this type of care. So we try really to use them for that reason. That's the big reason, that they're not people. On top of that, the only way we know for sure that the wound itself is healing the way it's supposed to, and it's not developing any sort of complications related to the surgery or to surgical technique or whatever it is that we can eliminate one factor, and that one factor is going to be that nobody else has messed with the incision. So if things go south and the incision does not heal well, you know, you may go ahead and say, oh, the veterinarian messed up, the doctor messed up. If there's no e-collar on your pet, we don't know if the doctor actually did anything wrong or whether your pet messed with the incision. And I hear all the time, people say, oh, you know, I sleep right next to my pet, or I'd wake up if they were moving around. The truth is you wouldn't, you won't. The pets will still get to it, and they'll do it covertly. You're not going to find out. Between work and going to sleep, you're not going to watch your pet 24/7. And I'll tell you right now, from over 12 years of doing this, the pets will ruin the creative work that the veterinarian has performed within seconds. Like, it doesn't take long. They'll do it. And if they didn't ruin it at that moment, well, the infection that'll start brewing will rear its ugly head in a matter of hours or days. And so the damage has been done. So you have to keep the e-collar on. It's unfortunately a necessary evil in this profession. And anybody who's had a pet that's had skin disease or surgery or a wound or a growth, etc., that the veterinarian has specifically instructed you not to let your pet lick or chew at the incision or the area. They know about these cones and they hate them, but that's why we have to use them. And so that brings us to the idea of, well, are there more creative or other solutions to this? And there certainly are. I've had clients that have created their own ways of preventing their pets from licking the incision or the wound. Most people just want a one-time quick fix. Everybody's busy and they're maybe not as creative. They don't have the time to do this. So you have the classic plastic e-collars that most veterinary hospitals will sell. They've now come out with ones that look more like lifesavers. They're inflatable donuts, and they're great because they're soft. The material is soft. It does not project itself like a lampshade, so there's less likely of a chance of your pet knocking things down, knocking into walls, the door, scraping your leg. And they apparently create enough of a barrier between your pet's mouth and the area of interest that they worked really well. And you can purchase these at some veterinary hospitals. You also can purchase them in pet stores or larger facilities like Target, Walmart. They'll have these things, and it's an inflatable cone instead of having the plastic ones. And that's a pretty good solution. I will warn you, of course, those pets that have longer muzzles, longer noses, they can sometimes get around these inflatable donuts, and those pets that are very flexible can also get around them. And I'm not so sure I've seen much success with those in cats. It seems that the smaller pets, smaller dogs and cats tend to wiggle their way out of these inflatable donuts. And so it's a good option for the right pet. It definitely is, at least as far as I'm concerned, probably second or third best. And I would say tied with this option is another one. So instead of having the plastic transparent hard cones, the classic e-collars, they make ones now that are just softer material, same shape, lampshade, and they're softer. They can fit any size pet, large or small, dog or cat. They work really well. The difference between these softer, more malleable e-collars and the plastic ones is that the softer ones can be bent. And so some pets will get creative. They'll actually turn their head around, find a way to bend the cone, and then allows them to get past it and lick the area of interest. The second problem with it is that it's not transparent. So you are creating kind of a blind spot with your pet. Now, most pet owners, and I would agree with this, would say that the transparent ones really aren't that transparent. And I agree. There's different levels of transparency. Some cones are quite translucent. Others are kind of a thick plastic material, almost white in color. And so you really can't see through it. So the ability to look through the cone is eliminated when you're using these softer ones. But again, doesn't seem to bother the pets in terms of the ability to get around the house, find their food, drink water, what have you. And so that's another option. And so I would say that the plastic cones by far are my favorite. They're resilient and they work. They've worked for many years. But if you're looking for other options, the inflatable circular cones or donut-shaped cones work really well. And then the more softer cones, lampshade-shaped cones are also a good option. And then it kind of depends from there. If you have a wound that's covered by a bandage, or you're able to place a sweater over the wound, like a dog sweater, or baby socks, or regular human socks around the paw, wherever this wound is, you can find other solutions that will, instead of preventing your pet from looking around to try and lick the area, you can just cover it. And you have to make sure that your veterinarian approves this. There are some wounds that we don't want covered. There are some wounds that we want exposed to the air. But you can figure things out like that depending on where it is on your pet's body. And for those pets who are really fat, who really can't bend at all, it probably doesn't matter where on their body this wound or area of interest is. You may not need any kind of covering or any kind of cone to prevent them from licking it because they can't reach it anyway. So that's kind of my take on this. I want to kind of move from there to sort of what are the disastrous consequences that can occur if you don't follow your veterinarian's instructions regarding the cone. If you decide, you know what, my pet hates it, I hate it, the cone is waking us up every time my dog moves around at night, they can't get to the food, they're not eating and drinking, they're depressed, well, then the consequences that you are risking are as follows. I've seen expensive surgeries, like surgeries that are $5,000 to $7,000 get completely undone by a pet. And now you're looking at not only revising the procedure with another surgery, you're paying more money. And of course, the outcome will not be as good as the first surgery you had done, had it gone right the first time. I've also seen, and this is pretty horrific, those standard procedures like spays, on your female dogs and cats. If they open up that incision, you're talking about intestines coming out. And I hate to sound gruesome about this, but it is something that I do see. And you would not believe the stories out there that veterinarians have of pets coming in with intestines hanging out. And the rare lucky pet will do fine if they see a veterinarian immediately and they don't get that sick from it. But boy, you do not want to be that pet owner to come home from work and find your pet has undone an incision with these vital organs hanging out of them. It's life-threatening. It's preventable. It's silly for a cone that costs a few dollars to have them undo an expensive surgery or even risk organ damage, organ exposure, or in the case of orthopedic surgery, you can lose your leg, your dog's leg or your cat's leg, because they ruined the incision and created such bad infection that now it's no longer a salvageable scenario. So this is why I sort of have to talk about the cones, because I see the ones that had a routine procedure done very well by their veterinarian and somebody was lax about the cone, whether it was the doctor or the pet owner. And then I see them for the complications afterwards, which were preventable. I don't mind fixing complications. What I'm here for. I am a surgeon. This is what I do. But it's sad to see a pet not do well because of something that could have been prevented very easily and really for minimal cost compared to the investment you made with the surgery itself. So it's silly. And have your pet sort of suffer through this e-collar usage for days or weeks is a small price to pay. They're going to be alive for years, people. They're going to be around for a very long time, your pet. They're not going to recall the trauma of having a cone over their head for a couple of weeks. Let's face it. I mean, they're going to be fine. Just go through it. Deal with it. Now, let's move on from there. Hopefully I've convinced you by now that we should use the cones. And let's move on to what kind of lifestyle your pet actually has when they're using these horrific instruments. So most of my clients will try to convince me that their pet cannot eat or drink with a cone on. And most of my patients are in the hospital for at least 24 hours, sometimes longer, sometimes several days. And I will tell you that the cone is worn by the pet in my hospital from the time of surgery until the time they leave the hospital. And they eat and drink just fine. They will eat and drink just fine. And maybe your pet is trying to play you. They know they're in charge. They're trying to convince you that, look, mom, look, dad, I can't eat, I can't drink. This horrible thing, this torture device is on me. Take it off, please. And they look at you with those puppy eyes, try to convince you. It's all crap. It's all crap. They're playing you because they eat and drink in my hospital with the cone on. I do that on purpose to make sure the pet gets used to wearing a cone and to convince myself that your pet actually can eat and drink with the cone on. They can eat and drink just fine. Now, listen, if you are convinced that your pet will not eat, will not drink, well, then you know what? When it's food time, take the cone off. Let them eat, get their meal in, and then put the cone right back on. A little more annoying, a little more labor intensive, takes a little more time. But if you're convinced, then fine. They need to eat and drink, right? They need to eat and drink to survive and to heal. So you can do that if you like. But the cone's got to go back on after you take it off. You can also take the cone off if you're going to hang out with your pet. So let's say you've got the evening off of work, or it's a weekend or holidays. You're going to have your pet by your side, right next to you. Take the cone off. Be with them. Have your hand around their head, around their neck. And just that way, you know, if they try to go for the incision or the wound, that you can tell and you can stop them from doing it. I'm okay with that. But the moment you leave the room, let's say you're going to go grab a beer in the kitchen, or going to go to the bathroom, you better put that cone on. It only takes a few seconds to a few minutes for your pet to ruin a very fancy surgery that your veterinarian has worked very hard for, that you paid a lot of money to make sure happens and happens correctly. So hang out with your pet, take the cone off, watch TV, do whatever you want to do. You walk out the room, the cone goes on before you leave the room. So at least you get some breaks. You feel like you're giving your pet some breaks. You're getting some breaks from the cone, and you know that you're being responsible during this time period. You're not permanently scarring your pet by wearing the cone. It's well worth it. You're avoiding huge complications by using them. And I want veterinarians to also hear the message, because just because a veterinarian performs a routine procedure like a neuter or a spay or removes a tiny wart off your pet, doctors, listen, you've seen enough times where the e-collar probably should have been placed and you decide for whatever reason, oh, it's a good dog, they don't need it. Or, oh, this pet owner doesn't really want to use it. Use them. Use the cones. It's worth it. It doesn't matter if the client or pet hates you for it. They're going to love you when the surgery heals. They'll love you when the incision heals. They'll forget all about it once it's over. So it's well worth your time to use these cones. Doctors use them owners follow your veterinarian's advice. And if you are a pet owner that's leaving a hospital after just having had surgery on your dog or cat, and there's no cone on, and you've heard this podcast, request one or buy one from the store. But get a cone on your pet, because that's the right thing to do. There's a reason why we have them. We're not enjoying torturing your dog or cat. We want to make sure they heal up well the same way you want them to heal up well. And so they're cheap. It's easy to prevent any issues from the surgery or laceration or wound or whatever's on your pet. And it's well worth it. You're gonna be happy you did it, because the alternative can turn into weeks and months of frequent veterinary visits, lots more veterinary bills, unwarranted headaches, and potentially even some pretty disastrous consequences to your pet's care, short-term and long-term. So I hope that I was able to explain why these cones are of use. I hope you understand the idea behind them and that they are vital to your pet's healing. So I hope that with this podcast episode, I was able to convince you as to why we use these cones on pets, both dogs and cats. Some creative options or alternatives that you can look into aside from your classic Elizabethan e-collar. And of course, veterinarians, please, I can't stress it enough, use these cones. It's well worth it. Thank you so much, everybody, for listening. I hope this was helpful. This is Dr. Shadi Ireifej, TrueCare for Pets, Chief of Specialty, Staff Surgeon, and part owner of the hospital. We're open 24/7. Please follow me on Instagram. Follow me on my YouTube channel. We've got some great educational videos, and also videos showing the progression of my facility in Studio City, Los Angeles, California. And follow me on Facebook as well. I appreciate your support. Let me know if you have any topics you want me to go over or any questions you want answered. I'm more than happy to address them all. Thank you so much. We'll talk to you next time. Take care.